And I get up. The Big Show on Kiss 92. Gotta get up.
Good morning, Singapore, and welcome to Good Morning, Doctor. It is a lovely Wednesday morning, and we have with us cardiologist from Gleneagles Hospital, Dr. Deanna Khoo. Good morning, Doctor.
Good morning. It's a privilege to be here. Thank you for having me on the show.
So nice to have you on the show today.
You got such a great radio voice as well.
Yes, exactly.
If you ever want to give up cardiology, just come over.
And why would she want to give up cardiology for this?
Can't you tell I'm joking? So, Dr. Khoo, this morning we're talking about heart health, but specifically women's heart health. Now, how important, and I'm sure it's very important, is cardiovascular, or how not dangerous, I suppose, how rampant is cardiovascular disease in women?
Well, cardiovascular disease, meaning things like stroke and heart disease, is the number one killer of women worldwide and in Singapore. So 1 in 3 women, which is a pretty high number, will die of cardiovascular disease. So it's a very important issue to look into.
Why do we not know about this?
How come no one knew this?
It's always breast cancer or, or fibroids or something else, that kind of cancer, heart health for women.
I thought it was more like men who,
exactly.
Who die of like heart attacks and strokes. And,
yes,
and
exactly. That's a very common misconception that cardiovascular disease is a man's disease, and perhaps a lot of it stems from men developing the disease at a younger age. So typically men will start to develop heart disease or present with heart disease in their 50s. It's thought that women are relatively more protected before their menopause because of the higher levels of estrogen in their bodies. But post-menopause, and women hit menopause roughly around the age of early 50s. Women very fast catch up with the men, so that when they reach their 60s, they too start presenting with heart disease. So I think a lot of women are aware of issues like breast cancer screening, the Pink Ribbon campaign, and they know that they need to get their mammograms done, their pap smears done. But surveys have shown that a lot less women are aware that they need to do their cardiovascular screening.
Right.
And that's why campaigns and social media such as this is really important to spread the awareness about the disease.
So if this happens, if they catch up with men after menopause, at what point, is that the point when women should start getting regular checks, or should they do it earlier?
I think checks should be done earlier. It's never too young to do a check. So in your 20s, 30s, you may want to get a check done maybe once every few years, because if you're one of the unlucky ones to develop some genetic condition that predisposes you to getting, say, like a high cholesterol, you want to check it. You want to get to it early and treat it early. But the national recommendation is really from the age of 40 that people should start doing their sort of cardiovascular screening.
Okay.
It's a lot less painful than a mammogram.
Oh,
I'm
yes,
sure.
thank goodness.
Because the last time we were on the topic of breast cancer and mammograms and all that, I think a lot of women, they dread going for something like that. But a heart check is painless.
It's painless. Yeah.
What does it involve?
So generally, you want to screen for things like blood pressure. That's very easy to do. If you have a machine at home, you can keep an eye on it quite easily. Blood tests for things like your cholesterol, diabetes. So those are the main lifestyle things that you want to detect at an early age. And then your doctor may choose to do further risk stratification, and that can be done with things like what we call a calcium score. So again, this is quite easily done with some x-rays and then a blood test like a lipoprotein A.
Does everyone have to run on a treadmill?
Not everyone has to run on a treadmill, but it can be a way of picking up major blockages in the heart. Yeah.
Okay.
Let's continue to talk to Dr. Deanna Khoo on The Big Show TV. Meantime, here's Benjamin Ingrosso with Kites on Kiss 92.
So, Dr. Khoo, you mentioned that cardiovascular disease is more common, 1 in 3, for women after menopause and at about the age of 60 or so, plus minus, right? What about for those that are premenopausal? Are those numbers very high as well, or too high?
Those numbers are not so high, but they do exist. Women might be prone to sort of a different subset of disease when they're younger. So, say in heart attacks for women in a younger age, the underlying problem may not be what we call plaque rupture, so coronary artery disease, formation of blood clot within the vessel. Women may be more prone to things like sort of what we call coronary artery dissection, so tears in the blood vessel, or things like for women who are pregnant, they may be more prone to developing things like heart failure in pregnancy. So there are different conditions that may be more relevant to women at a younger age. In terms of cardiovascular disease, coronary artery disease, probably less common in premenopausal women, but there are certain subsets of women that may want to screen earlier for the disease. So there are risk factors in women, such as if they had problems during their pregnancy, like gestational diabetes or high blood pressure during their pregnancy. These women may want to start screening at a younger age for heart disease because they'll be at higher risk.
So is that what causes the tears in the vessels, like what you were just talking about?
Yeah, so conditions like high blood pressure, hypertension can cause those tears.
Oh, wow.
This is a question that comes out of ignorance. Many people say, and I'm sure it's true, as women have children, their bodies age faster. Does that put extra stress on the whole cardiovascular system?
I'm not so sure about age, but being pregnant does put extra stress on the heart. So if you have an underlying heart condition, then that can sort of bring it out, or that can potentially cause complications because there are a lot of fluid shifts in the body when women go through that. But getting pregnant itself shouldn't age the body, but we know that women that experience problems with their pregnancies will have a higher likelihood of going on to develop heart disease later in life.
Is that the impression you've had all this
I
time?
know, right? I'm like, what do you mean age?
What kind of a question is that?
This is grandmother's tales. You know, your system ages every time you get pregnant. It's something that I heard and I never bothered to check.
It could be having children that ages.
Yeah, exactly. The actual child itself. Yeah.
At this point,
And the husband as well. Yeah.
It's like, you're going to drive me to the grave. Stop shouting.
Nonsense.
at this point of your life, you're still thinking about grandmother's tales.
Oh, yeah, hell. I still live with a lot of my grandmother's tales. A lot of them.
So, doctor, I mean, we talk about cardiovascular disease and all that, but what are some of the symptoms that we should be looking out for? You mentioned blood pressure. You mentioned some lifestyle habits, perhaps, that we should be getting rid of.
So symptoms, I think symptoms-wise, the most important symptoms to look out for would be for that of a heart attack, because that's the most time-sensitive condition that you need to go and seek treatment for. So for the heart attack, the most typical symptom would be chest pain. Typically, people would describe chest pain as like a central crushing chest pain or a squeezing pain in the chest. Sometimes it can radiate down to the left arm, or it can go up to the jaw. Sometimes it might be associated with symptoms like breathlessness or sweating. So those are the very typical sort of symptoms that both men and women may present with. The problem with women is that we have a higher tendency to present with symptoms that are a little bit more atypical. So women may not have the central crushing sort of chest pain. They may have a sort of more diffuse pain in the chest, or they may have pain in the abdomen or in the upper back. They may have sort of more feelings of generalized fatigue or nausea. So they present a little bit more atypically, which in itself brings problems because women may not recognize that they are having a heart attack. And so they may present to their medical providers later. And even at the hospitals, again, because your symptoms may be a little bit more atypical, the doctors may start investigating for other things first before the heart attack. And so studies have shown that women tend to present later to the hospitals, and when they do get to the hospitals, they tend to receive treatment later than their male counterparts.
Okay. That sounds a lot.
He's gone through it.
Yeah, the heart attack. But what were your symptoms, though?
The doctor described
pain in the
symptoms.
chest, up through the jaw, and copious amounts of perspiration. Yeah, it's just absolutely crazy.
So you went to get the ballooning done immediately, right?
Straight away. Well, no, I was a bit of a Superman. Yeah, I went the next day. But yeah,
That's not Superman. That's just being like
I was
in
just being-
denial.
That was being stupid. That's what it was.
Can someone experience a heart attack, not do anything about it, and then later on go to a doctor, and the doctor will say that's what you had, even if it's years later?
They can.
Can it be seen?
They can, because heart attacks essentially is blockage, the complete blockage of the vessel. Everyone's heart has 3 vessels that supplies blood to it, and not all 3 vessels are as important.
Okay.
So you may have a blockage in a vessel that may be lower down or in a smaller vessel, and sometimes patients can go on living even though they've got a blockage in that vessel.
But there are only 3 vessels. There's so few.
Yes.
It's like, can't we have more?
So can't we just go straight for that test? Because I've gone for it before, like 5 years ago, and according to my cardiologist, whom I've known since the age of 40, so I started going for my checks at the age of 40. I remember wanting to pick up Brazilian Jiu-Jitsu, and I knew how rigorous it was. And so I went for this thing where they pumped like ink into my...
to see the
What
flow.
do you call that?
Yeah, so that's a cardiac CT.
Okay, wait.
Cardiac
let's go
CT,
on
okay.
Coronary
Let's talk
angiogram,
about
yes.
cardiac
Yeah.
CT.
Okay, yes.
Kiss 92 traffic.
On the AYE towards the MCE, look out after Jalan Bunlei's exit, a vehicle's broken down. Avoid lane 3. Also on the PIE towards Tuas, an accident has been spotted before the Clementi Avenue 6 exit, causing a backup all the way to Eng Neo Avenue. That's quite a stretch. Avoid lanes 2, 3 and 4 or the PIE altogether. If you see anything else, our number is 8855
Welcome back to The Big Show and The Big Show TV. Our guest for this morning on Good Morning Doctor is Dr. Deanna Khoo, cardiologist from Gleneagles Hospital. And I was just asking the good doctor about cardiac CT, because we're talking about heart attacks and all that,
Yeah.
right? Wouldn't it be so much easier if the patient just goes in, does a cardiac CT, and then you can tell if there's a blockage or not?
Yeah, so the cardiac CT or the CT coronary, what we call the CT coronary angiogram, has become increasingly popular for doctors to utilize these days. The advantage of doing a cardiac CT would be it can pick up even if you have a little bit of disease. So if you have minor disease in the vessels, say disease that's less than 50% or 50 to 70%, the CT is quite good at picking it up. So you kind of know where you stand in terms of how much disease you have. If you contrast that against what is, again, quite commonly done, the treadmill test.
Okay.
So the treadmill test is good at picking up if you have a major blockage in the vessel, sort of 80-90% blockage that's affecting the blood flow to the heart muscle. So the treadmill, when you're running on it, the heart cannot cope if you have this blockage, and we start seeing signs on the ECG that something is not right. The treadmill will miss out sort of minor blockages, whereas the CT is quite good at picking up minor to severe blockages. So it's quite good at sort of painting a picture of what your heart disease is like at this point in time.
Right.
And if we find that you have some disease, it may not be 80-90% blockage that requires a stent or bypass surgery. It may be 40-50% narrowing that you have, but once we realize you have that, we can start giving you treatment, medications to make sure that whatever disease is there doesn't progress over time.
I see. Is the cardiac CT a more expensive option, and that's the reason why most people don't go for it?
It is a more expensive option than doing a treadmill. Also, there is contrast that we would have to give. So it's not for everybody. So if you're interested in getting it done, or if you're having some symptoms and would like to have it done, then you have to talk to your medical provider.
Yeah,
about
I
getting
did it 5 years ago.
Yes.
And I was so nervous after the whole thing. I felt like,
Right.
oh my goodness, something doesn't feel right. But then when I went to his office in the afternoon, he said, clean as a whistle. So that's 5 years ago, right? And I think I'm due like maybe beginning of next year
Soon,
to go
yes.
for another one.
So
and
it's
I'm
every
nervous
5
again.
years, yeah.
Because
Yeah.
it's been 5 years, right? And I haven't exactly been...
The healthiest.
Yeah, exactly.
I'm
In
nervous
terms of
just
my
thinking
diet.
about it, Just thinking about doing that test, I'm nervous already. Just
Wait
like,
till you do the treadmill. So she's not a runner,
Yeah.
right?
No.
But we're talking about the treadmill test, and I've done the treadmill test over the years
Yeah.
a few times. It can be quite intimidating because it's in a room that's kind of cold.
But it doesn't
and then
mean if
run.
you don't have stamina, it's going to pick anything up. It actually watches the heart, right?
Yeah.
That's what the treadmill does.
But
right?
imagine feeling so nervous, right?
I know, I'm
And then
feeling-
your
already
heart's already
nervous now.
beating faster.
But you know the relief you get coming off it when you get
Of
that
course.
clean bill of health.
Of course.
Yeah, money can't buy that.
I want to bring something up when we go on the Big Show TV because the symptoms that you spoke about a heart attack feels very much like symptoms that I had some years ago. So I want to talk about that.
Okay, it's 8:19.
Kiss 92 Time Check brought to you by
So you were talking about a heaviness in the middle of the chest and then finding it hard to breathe. So I was a smoker for 30 years. And one day I was going to sleep. I wasn't sure if I was asleep or not. And I felt as if someone was sitting on my chest. And then my breathing became as if I was using an inhaler. So it was going like that, you know, and I'd never used an inhaler because I don't have asthma. And it went on for I don't know how long because I don't know whether I was awake or asleep. And the next day I quit smoking. Was that a heart attack or symptoms of? Because with what you said sounded a lot like what I went through.
Yeah. So sometimes it's very difficult to differentiate what causes the chest pain.
Okay.
Chest pain can be due to many different things. It can be due to the heart. It can be due to sort of dyspepsia, which is gastric causes.
Indigestion.
It can be due to musculoskeletal causes.
Okay.
I think the most important thing to make sure is that it's not a heart attack and it's not a cardiac cause for the chest pain. So once you've done the relevant tests to exclude that, make sure your heart is healthy, then we can usually start to look at other causes of the pain if the pain is recurrent.
No, not.
Yeah.
It's just a one time.
If it's one time, then less likely that it was.
Oh, thank God.
It was probably a little bit of a panic attack as well.
Maybe,
because at that
maybe.
point, you were thinking about,
Not really.
well,
I wasn't.
could it be, could it be that I'm having...
No, I wasn't thinking that. I didn't know what it was.
It was someone telling you to quit smoking.
I think so.
That's
because,
what it was.
Because it was just like, as I said, I don't know if I was asleep or awake, but I could feel everything that was going on.
Yeah.
Maybe it was a spirit sitting on
Maybe,
you.
who knows? It could have
knows?
been. Yeah, it could have been. But I mean, it made me quit, so it was a good thing, no matter what. But do all people that have cardiovascular disease have high blood pressure?
Not everyone will have high blood pressure,
Okay.
but high blood pressure is a very common condition to have, and half of people over 70 will develop blood pressure. So a large number of people will develop high blood pressure in their lives, and high blood pressure is one of the risk factors for heart disease. So if you have high blood pressure, then you have to sort of watch yourself, make sure it's well treated, and if you have symptoms, then get yourself checked out.
Yeah.
So high blood pressure can be caused by various things. I mean, stresses of daily life can cause high blood pressure. Genetics can
Lifestyle.
cause lifestyle.
Food.
Is just a basic aging of your system? Does that cause it as well?
Yes, there are sort of different mechanisms that bring about the high blood pressure, but as we age, our vessels get hardened. Yeah, so when the vessels get hardened, they're not so compliant, and the blood doesn't flow through them as easily as it does when you're younger. So that usually will bring up the blood pressure. And then if you add in things like an unhealthy lifestyle, if you're sedentary and you're not exercising, you're taking in copious amounts of soy sauce, then that sort of adds to the problem and aggravates the high blood pressure.
I've opted for medication. So I'm taking because my mom has it, my dad has it, it's so irritating. Because if not because of that, right? I mean, everything will be fine. Because I do watch my diet, I do work out, but I do love my alcohol and my cigars. So so I've opted to to go for
Take
medication. Why
medication.
don't many people want to take medication, doctor?
I think these days people read a lot of things on the internet. So once you type in something in the internet, you get a whole list of side effects that medications can potentially cause. So sometimes that puts people off. And the other thing is, hypertension is something that you don't really feel a lot of the time. So you might have an elevated blood pressure, but you can feel well with it. So taking the medication doesn't make people feel any better. And they don't really see the effect of taking the medication.
Right.
But really having that high blood pressure puts them at the increased risk of developing the disease to multi-organs, your kidneys, your heart, high risk of stroke later in life.
If like Glenn, for example, he's on this, I'm on it. It is a lifetime thing, isn't it? Once you go on it, you're on it.
Really?
Yeah, you're right. Very often, unless they are, say, obese or leading really unhealthy lifestyles and they make quite a dramatic switch, a lot of the time, once you go on the medications, it does become a lifetime commitment. Yes. Yeah.
So, doctor, you spoke about how important our veins are. Those 3 veins that take blood to the heart. 2 parts to my question. How can we keep our veins healthy? Because I feel like that's so important for a healthy heart. But correct me if I'm wrong. And secondly, what are your thoughts on aspirin? Because my parents, when maybe about 20 years ago, they were like, take half an aspirin a day, keeps your blood thin enough to flow and all that. What are your professional thoughts on that?
Yeah. So firstly, how to keep your coronary vessels healthy? So it would be things like lifestyle. First of all, for everybody. So don't need a sedentary lifestyle. Get enough exercise in your diet. Not smoking. A reasonable amount of alcohol, so keep that level low. So things like that, lifestyle, and then screen for the heart diseases. So screen for your high blood pressure, your cholesterol. If you're found to have it, then treat it early and don't let it fester for a prolonged period of time, because that coronary artery disease will develop. Okay, so that's how you can help to keep your vessels pristine. With regards to the aspirin usage, aspirin is not for everybody because while aspirin can reduce risk of things like heart attack and strokes, the thing about aspirin is because it thins the blood, it can also increase your risk of bleeding, particularly in more older patients. So we don't give aspirin for everybody. We generally will give aspirin for people who have the disease. So if you have coronary artery disease, a decent amount of it, if you've had a previous stent put in or you've had a previous stroke, these would be the patients that we would want to start on.
So don't self-diagnose, right? I mean, don't just take it every day just because you've heard that it's good for you.
No, I wouldn't.
Okay.
Okay, we're going back on air one last time. It's been good, huh?
So quick, huh?
Yeah, it's quick.
Kiss 92 traffic.
We have a couple of situations to look out for. In the Woodsville Tunnel heading into the city, avoid lane 3 of vehicles broken down. Also on the TPE towards the PIE, an obstacle has been spotted before the Loyang Avenue exit. Look out for that in lane 2. And finally on the BKE, an accident towards the PIE. This is at the SLE exit. Wherever you are this morning, stay safe.
Welcome back to The Big Show on The Big Show TV. Our guest for this morning is Dr. Deanna Khoo from Gleneagles Hospital. She is a cardiologist, and we've been talking about women's heart health.
And speaking of women's heart health, Ashley comes onto our Facebook page and says, thank you, Dr. Khoo, for the double stent surgery in my heart last year.
Oh, I'm sure you don't remember all your patients.
Got a lot of patients.
So hard.
Eddie is also asking, nuts and berries, nuts and dried berries, they're supposed to promote good heart health. Is that true?
Yes. So the diets that promote good heart health would be diets like the DASH diet, the Mediterranean diet, and you'll find that these diets encourage high intake of things like fish, fruits, vegetables, mixed grains, things like nuts. And berries.
Okay.
Good to be a pescatarian.
Yeah.
Then I've got a few friends who have, they're all like about the fish now.
And a Mediterranean diet, because there's so much greens. There's the olive oil.
But I've
there's the
challenged
fish.
them all. I'm like, let's see how long this lasts. Don't talk big. Yes.
Doctor, it's been a fantastic conversation. But if there is one thing you can say today that you hope anyone listening in will take away from this conversation that we've had, what would it be?
So I think I would like to stress that heart disease is important in women, as important as other things like breast cancer. We place a lot of importance on our appearance. We have 10 steps for our face in the morning and evening. Do the same for your heart. Take the time and the effort to look after it. Get yourself screened early for risk factors for heart disease. And if it's there, treat it early. If you have symptoms, get yourself seen early as well.
Fantastic.
Hey, what about women with, broken hearts? I mean, does that affect the heart as well? Because I was talking to my cardiologist once, and he was saying, like, a person can actually die of a broken heart,
They can.
What does that mean?
There is a condition called what we call stress-induced cardiomyopathy or Takotsubo syndrome, and it does affect women more than men. Typically, it's brought on by an intense emotion, so a big fight or they've fallen over, and it can lead to weakening of the heart, and people can die from the
Yes.
condition.
So it literally
it
is.
it is
Literally a broken heart.
a real condition. Yes.
Wow.
Yes.
See?
Wow.
Yeah.
You think I talk nonsense
All
most of
the
the
time,
time? No,
All the
except
time.
now.
Yeah.
I know things.
Oh, yes. Seems like it.
Thank you so much, Doctor, for joining us today. We hope you had fun with us as well.
Thank you very much for having me. Thank you.
Thank you for tuning in to The Big Show.
Kiss 92 traffic.
Plenty of peak hour traffic. It is only 8:38 after all. But on the PIE towards Tuas after the BKE, if you're heading down that stretch, do avoid lane 1. An accident has been spotted. Anywhere else, if you spot anything on or off the roads, you can WhatsApp us 885550
Good morning and welcome back to The Big Show and The Big Show TV. With us right now, Lars Nielsen, the Managing Director of BMW Group Asia, as well as Charmain, Kwee, the Executive Director at Eurokars Group. Welcome.
Thank you so much.
Good
for having
morning. Thanks for coming in. So, okay, just a little bit of background. Tell us a little bit more about this relationship between BMW Group and Eurokars. Charmain, maybe you can go first.
Okay, so as of I think little less than 2 years ago, we've actually first become the official dealers of BMW as well in Singapore. And actually, our relationship with BMW has extended way past 20 years ago. And we've also been actually carrying brands such as Rolls-Royce and Mini in both Singapore as well as Indonesia. And we've actually done BMW in Indonesia for a very long time as well. So yes, I could say that Lars is a very familiar face. And it's very nice to actually be able to have such a long-standing relationship with the brand too.
I just want to say you've got a beautiful voice.
Thank you.
Right.
She does, yes.
Absolutely. Lars, you guys have opened 2 BMW facilities in the last 2 years.
Yeah, so for Eurocars, they actually have split up the facilities, right? So on Kun Chong, there is an absolutely amazing setting. You will be able to experience BMW M, the M brand, as well as our luxury class vehicles. And on Lenki, we very recently had the renewed facilities, or the facilities were refurbished, and you'll be able to experience both BMW and the Mini brands together with a wonderful lounge setting as well, by the way.
That's so interesting that you've actually developed a place for the M brand. I think that's a great idea.
It's a massive commitment and a wonderful. It's a wonderful commitment, actually. A massive investment that Eurocars has done for us there. We are very, very proud of it, and we're very, very happy with what the Kwee family is doing there.
Yes, you should be. Congratulations on the new spaces.
Thank you.
And then Glenn, you've seen.
Yeah, I've been to
place.
the flagship as well as the experience.
And you were quite impressed with the whole sort of coffee, the whole area, the whole
I came back, I was telling them.
Yeah.
No, it's just a beautiful.
He was raving on about it.
Beautiful space, I mean, all the cars are there. It's and what about servicing, Charmain? Could you tell us a little bit more about that?
Okay, so I think our entire goal, or rather I think you have seen the spaces as well, Glenn, is that our entire motive is to basically give and provide customers with this unparalleled experience. So this means giving them that holistic peace of mind from the moment when they step into the showrooms or the service centers, greet them with coffee, food, breakfast. We have dim sum as well for those who prefer Asian food in the morning. We also have pastries for those who prefer more Western snack.
Yeah, right.
That way you're eating.
I have my morning meetings at Eurocars.
You feel like you're in a lobby lounge.
Oh, wow. Lars is like, nobody's going anywhere. You come to me.
And that's the idea, right? So we want people to feel comfortable as if they're at home, away from their own home itself. And with that said, it also kind of increases this whole convenience and peace of mind for our customers too, because we actually are able to service all BMWs regardless of whichever dealer you've bought them from, as long as they're authorized dealers. So like I said, this is really for the convenience of the customer and where they would like to go. And for us, we actually have 3 service centers to maximize that convenience. So I think you visited Kun Chong as well, which is our BMW Experience Center. So this is just 1 street away from the main automotive belt, and that's right in town as well as in Central, as well as Lenki. So we have that 2 service centers right in Central just for our customers, and of course for all BMW owners. And also we have 1 out in the west at Penjuru. So that one, also you have the whole lounge experience too, coming soon next year. But for now, we have pick-up drop-off services. We also have next day booking services available for the customers at these 3 places too.
I love that pick-up drop-off. You're like, I'm not going anywhere. You just come to me, take my car, do what you need to do, and bring it back.
Okay, let's continue to talk to Lars as well as Charmain on The Big Show TV.
Wake up. Glenn.
So, Charmain, could you tell us a little bit more about BMW Eurokars Electrified?
So this Electrified series is actually this initiative that we've decided to basically help to kind of create more awareness about EV vehicles. Because I'm pretty sure that you guys know a lot of people nowadays are like, oh my goodness, there's so much EV cars, range anxiety, what if I run out of battery halfway through Malaysia and everything else. But in actual fact, the car actually can do a lot more than what you think. And I think with this, more awareness and education is needed. So what we do is we actually bring our BMW owners who own EV cars with us across to Malaysia as well. So we went to Desaru, we went to get breakfast drives with them as well to kind of create kind of bonding session. We've also kind of created and made spokespeople out of our own customers as well to really share about their experiences with their EV vehicles. And I think that's the best way to really create that sort of awareness and confidence in EV vehicles too. We also regularly have people such as, I think Julian from SG Karma was with us as well to be on a panel to kind of talk about their views on this whole EV trend taking over the industry as well. And those EV experts to really give our customers that assurance and more information so that they can actually then decide and be more discerning as to whether they think EV is something that fits their lifestyle. I think for us, it's not so much of, you know how in Singapore everyone's like, oh, EV is coming. But I think for us, it's really more of giving them the other option, the other alternative to combustion engine vehicles, right? So I think the luxury of us being in today's day and age is having options. If you feel like you want to be a bit more sustainable, you want to be... you don't want to worry too much about pumping petrol and everything else. You always have the option of having EV vehicles. But at the same time, if you really love the feel of the engine, you want that raw, BMW also provides you with a very holistic mix of combustion engine vehicles and performance vehicles as well. So I think ultimately really it's just to cater to what the customer really wants. And I think that's only fair. And to give them that fair choice, we have to provide them with as much information and awareness as possible.
Yeah, and I think if anyone's sort of like watching and thinking, I want to go EV, but as you said, there is that range anxiety and all that. If there's any country in the world that's good for an electric vehicle, Singapore has to be it because we're so small. You know, every corner now that you go, there is a charger. And as well with Malaysia as well, the infrastructure has really been built up with companies like Charge Plus and all that. You will have at every stop that makes sense, there will be a point to charge. So, I mean, like Singapore, some of the ranges of the cars like go past 500. You're not going to drive 500 kilometers in one day.
Do you agree with her, Lars? You can disagree with her.
You're allowed. Sure, let's have a debate.
No, I agree a lot. Yeah, and thanks a lot for not letting the Ang Mo say that Singapore is a small place.
It's okay, the Singaporean can say it.
Yeah, exactly. No, so the range anxiety is a thing, and we've seen that around the world as the technology starts getting adopted. I think Charmain and the team are really doing a great job in making sure that it's made possible to try out the technology, also before buying, before committing, etc. And I think that's really important. And if EV is the thing for you, that's great. If EV is not right now the thing for you, that's also great. I think what BMW Group is doing is very aligned with what Singapore is looking for anyway. A cleaner technology, a cleaner drivetrain technology going into the future, and you get that irrespective of whether you choose an EV or a combustion engine as it is today, and that commitment will go on into the future as well. More charging points are coming up. Life is going to get easier also if you are an EV owner. That commitment has been made here in Singapore as well. It really, I would not consider that to be a problem going forward.
Yeah, I think those drives to Malaysia are very important because, as you said, right? I mean, building up that confidence. Yeah. Because a lot of people here in Singapore is not an issue, but many people love driving into Malaysia as well. Yeah. And once they feel confident that everything will be fine,
Yeah, they'll also do it themselves as well, you don't have to always follow us. But I mean, ultimately,
of course,
give them that safe environment as well. Just in case anything happens to you across the border, we're there for you.
And it's not about just going to Johor or Desaru. It's about, a lot of them like to go up to KL, Penang, they really like to do those long drives.
Eurokars, always there for you.
Oh, well done. Go. Oh.
New slogan.
Oh, there you go. Good stuff.
Okay, so Lars, if you could tell us, what's the next concept for BMW retail?
So the retail next concept, which is what Eurokars has implemented here, is essentially a very friendly. It's a very friendly space, right? And it's a space that's conducive for making good transportation or investment decisions. I won't lie about that. So obviously we have a keen desire to show the products from their best sides, and that's what we are trying to do in this context. But not only show the cars, obviously we want to create an environment where that's friendly, that's open, you don't feel any pressure, and I think that's where when Charmain is explaining the Eurocars add-ons there with dim sum and whatnot. This really kicks in, right? Fact of the matter is, though, irrespective of how much effort we put on the hardware, so buildings, environment, putting the cars in there and so on, in the end, it's going to be about the people. Right? In the end, it's going to be about the people, right? And I know that's where Charmain and the Eurocars team, they're putting a lot of effort into making sure that the relationship is nurtured as well, particularly in Singapore, where the price for cars are ambitious.
Ambitious, I like that.
And you need to really consider what you're doing. You would wanna know that you make the right decision and you feel good about it, also for the full ownership period. Huh?
Yeah, owners really appreciate that personal touch.
Of
Yes.
course, that after sales service is so
always
important.
that.
Yeah.
And they will spread the word, no doubt about it. As well. So Charmain, what does BMW Eurocars have in store next that people can look out for?
Wow. Actually, so many things are happening, but I think recently we're just kind of reeling from the excitement of just unveiling our most recent flagship center. So this has been revamped and rebuilt to really cater to the whole Retail Next facility to provide even more servicing space, lounge space, and work from home spaces, of course, for our customers and visitors as well. So I think that in itself is a very exciting project for us. And coming up next year, shortly, would be the revamp of our Tanjong Penjuru service center. So the entire level 1, it's going to be revamped for BMW customers too. A nice enclave away from town if they want to escape the hustle and bustle of the city for a little bit, to really relax, enjoy, do their work there. Again, eat dim sum or whatever else that you want there to, because you can't go wrong with food as well, right?
That's true.
Yeah.
So that's another place you'll find me.
Straight to the
office.
heart of Singaporeans, right? Food.
Okay, we're going to go back on air one last time. That's Selena Gomez, Love You Like a Love Song, right here on Kiss 92, all the great songs in one place. And we've been having a great time chatting with Lars Nielsen, Managing Director of BMW Group Asia, as well as Charmain Kwee, the Executive Director of Eurokars Group. I finally get to meet you, Charmain.
Nice to meet you too in person, finally.
So you both of you have talked about how important the customer is, how focused you are on the customer. We're not even over with 2004, and so far you've already held close to 30 events this year. I mean, that's almost like an event, more than an event every fortnight. What do we have in store in 2025 that your customers and future customers can look forward to?
I think definitely you can look forward to a lot more events, be it either Eurocars Electrified events like I was mentioning earlier, be it other normal drive events that we have. Actually, in fact, we have our Drive of the Year coming up towards end of November. And of course, more servicing spaces to cater to all BMW owners, regardless of whichever place that you've got your BMW from as well. So I think the idea is just to create that hype, create the convenience, and really create a whole fan-based brand for BMW, I guess, Lars? Yes?
Yes, most definitely. But I think there's a hustle and a bustle as well here in Singapore. People tend to be relatively busy. So obviously the transportation needs and the fact that you need to get from A to B and that needs to be efficient, that for sure will be taken care of. And then I think there needs to be a little bit of fun also, right? So I know Charmain and Zima are working very actively as well on taking care of when we are not exactly working. What could we then do also with our cars? Huh?
Right.
Yeah.
Nice.
So I shan't reveal too much exactly about what's the store for next year, but it's definitely a lot more exciting things for our customers. It's definitely something that they can definitely look forward to.
Okay.
All right.
Very
Kiss 92
exciting.
fans, do you hear Charmain? We'll let you guys know what they're up to, okay? And also, before we let you go, Charmain, would you like to say anything to all your Eurocars customers?
I think for one, it's definitely a big thank you to all of you guys for supporting us from the inception since 2022. Yes, I think it's a very exciting journey that we've all been on, and Also, a massive shout out to my team as well for really going through all the events with me, and also massive shout out to Lars and his team too for supporting us throughout all of this time. It's really exciting to be part of the BMW family in Singapore, in addition to all of our long-term relationships in the other countries as well. And I think we're all really here just to serve you guys better and to really deliver the unparalleled experience for all of you. So if anything, please come down and visit us at our new flagship centre. It's a really nice space. Come down, enjoy, catch up over a cup of coffee with us, and we'll be more than happy to have you guys with us here or in Kwun Chong at our experience centre too.
And there's also dim sum.
Oh, dim sum, yes, of course, dim sum.
Don't
miss
forget
that
the
one.
dim
Don't
sum.
miss that one out.
Yes.
Dim sum and more.
Yeah.
For service your car, remember to get some dim sum and coffee.
Thank you so much, Charmain, for joining us today. Thank you very much, Lars.
Thanks for having
Thank you
us.
guys for having us.
Wake up feeling